And you can also access it through the regular old NLADA website by clicking on trainings and technical assistance and then webinars, which you can also access all of the slides. The slides are currently uploaded there, so if you want to click along on any of the links, you are more than welcome to do that as well. Throughout the webinar, you can ask questions, let us know if you have any technical difficulties, and the sort through the box on the bottom with Q&A, or you can directly chat us by clicking on our names and clicking the little chat icon that shows up on the right-hand side. So today's presenters, my name is Casey Chiapetta. I work with the legal services team here at NLADA. Radhika is also here, who many of you likely know. And then we also have Elizabeth from Legal Aid of West Virginia, who will be sharing with us her information around screening for opioids and how they've strategized around that and around their work. You can also reach out to us at resourcedesk@NLADA. That email is on the last slide if you are seeking more individualized training and technical assistance, or if you have any follow-up questions from this webinar. So on today's agenda, and we're hoping that this webinar lasts about an hour. We don't expect it to really go for more than that. We are trying to be considerate of your time on this Friday. So we will start with a quick overview of what we spoke about in the last webinar. Like I previously mentioned, this is part of a 3-part webinar series on addressing the opioid crisis. Then I'll go into a bit of an overview about collecting data, why, how, and then getting ready for some challenges that you will likely face if you are going to tackle this. And then we're going to hear from Legal Aid of West Virginia, and then there will be time for designated Q&A at the end. We can also have Q&A throughout. If you have any burning questions, just send them on over in the chat box or message me, and I can either answer it or pass it on over to Elizabeth, and she can answer it for you. So in the previous webinar, which happened in early October, we spoke about how opioid use disorder, OUD, often has ripple effects throughout the entire community. It's often not confined to just one individual or one family. Communities are impacted economically and socially when members' lives are destabilized. Approximately 11 million Americans have been impacted by OUD. And this webinar is a really good primer on really all things opioids, from understanding how legal aid can partner in this crisis to what sorts of funding opportunities are available for your work. So you can access all of these different funding opportunities on Legal Aid Resources, which is a site that NLADA maintains that has over 250 federal funding opportunities. And it breaks it down by, is there express language for legal aid, what the deadline is, who the eligible applicants are, etc. I am going to quickly point out the last one, the Opioid Family Support Program Forecast. This grant should be released on November 4th, so it's coming up really soon. And we're very hopeful that there will be language related to legal services based on the fact that HHS HRSA is putting out this federal funding opportunity, and also that legal aid has a demonstrated history of helping with the 4 aspects of recovery. In this webinar, we also talked about a slightly different source of federal funding, state-administered federal pass-through, and you can see more of these both in the webinar if you want to access the recording, which you can do so on our YouTube channel or in the regular NLADA homepage. And then you can also read more about these special grants through the JGP grants matrix linked below. I will also mention that while there are links throughout this webinar, we also have endnotes at the end. So if there isn't a link on the slide, you will be able to access it at the end as well. So moving into the substantive work of this webinar. So why collect data? How can we use outcomes data to improve services, to apply for funding, and to increase our reach? So Because there might be limited infrastructure for data collection, tracking, and analyzing, there can often be concerns about the burdens of collecting data, over-reliance on data, and perceptions of limited practical value. But using data well allows you to report and better report outcomes to funders, access funding, making the case for increased funding, and informing the public and community about the importance of legal aid and its ripple effects throughout the entire community in terms of providing a more holistic or wraparound approach and the greater social return on investment. All to say, using data can help you do a lot, especially with an increased emphasis these days on funding evidence-based practices. So if you have the things that show what we're doing works, you're more likely to be successful in your application. As it relates to opioids, something we've heard of pretty much time and time again is that while there's funding available, a lot of civil legal aid doesn't necessarily have the data, or they haven't been tracking and collecting the data showing that they've been serving this population. But as we discussed in the last webinar, you're likely doing it already because opioid-related legal needs aren't just related to substance abuse. It's related to family, housing, public benefits, disability, keeping children in school, and more. In the 2018 survey of LSC grantees, 95% of them reported that they provided services to individuals with OUDs. So if you're one of them, or if you're not LSC funded and you're doing this, please start collecting that so you can make the case for funding. So backing up a little bit, we're going to be speaking about outcomes. So outcomes are what civil legal aid produces. So what was the legal result? Was there a change in someone's housing status, stability, impacts on the community? While outputs are important, what we really like to see is the effect of the provision of legal aid. A great resource for you as you're doing this comes from the National Center for Access to Justice at Fordham Law School. So you can click on the link on the slides, or you can Google it. So in this guide, those who put it together interviewed legal aid leaders, funders, attorneys, and national experts on data to help develop a guide for civil legal aid providers and their funders to use data to track and report outcomes achieved by legal aid services and other social service providers. And as I go through, I should mention that some of the best practices and tips and more are informed by this guide. So please go and check it out. They also have a really great appendix at the end with exactly what types of outcomes legal aid programs are successfully tracking and how they are doing. I should also mention that the National Center for Access to Justice also puts on the Justice Index. And if you haven't used that, I highly recommend checking it out and seeing what state-specific data there is for you, such as how many lawyers are there per person in poverty, how your state relates to other states, et cetera. So 3 big questions to consider as you're thinking about collecting and using your outcomes data. Talking about access to legal services, talking about general justice, and then perceptions of the program and implementation. So I'm going to dive a little bit more in depth of how you can track these different outcomes and why it matters. So asking yourself, to what extent has your work impacted access to legal service? So thinking about how that legal assistance was actually provided. And then not only how was that legal assistance actually provided in terms of was it more limited in nature, was it full representation, but then also how many cases have you touched? So for example, one of the program evaluations that I'm going to reference at the end of this, they found that, that despite only having one attorney on this project, the project assisted 3.5% of all cases brought to that specific housing court. So the answer, the number may be higher than you think, and you can really see the work of how your organization is impacting greater access to justice in the community. To what degree has your work impacted case outcomes? So you can compare those assisted with your program to those who are not assisted, and compare these outcomes. Granted, that question and that topic is going to take a bit more effort both upfront and throughout, because you'll have to identify those who have not been assisted. Or you could even do maybe those who received limited assistance, like advice, or those who received full representation. And there have been studies that have done this, and if you're interested, I can send you links to them. Even so much as being able to say that when we provide assistance, 53% receive a favorable outcome compared to only, let's say, like 4% who don't receive assistance is a very powerful thing. And you don't need to have an advanced statistics software like SPSS or R to be able to do these things. Having that ability could allow you to say with X% of confidence or at Y significance level, we can say that our program positively affects clients and they are blank times is more likely to have a favorable or positive outcome when we assist them. So then you can also think about how well was the program implemented? How long did it take for a case to close? If you wanted to get some more qualitative data, you could ask volunteers or those assisted, how did you feel about the way your case was handled? Do you feel like you understand the law more? There have been really interesting studies that have looked at how those who have received or those who have been assisted with record clearing perceive themselves to be more welcomed by greater society and to experience boosts to their both self-esteem and mental health. So then this is the example that I was speaking about earlier. Legal Aid Society of Columbus did a project evaluation. And the statistic that I mentioned previously about them having one attorney and surveying 3.5% of all of those who went through housing court comes from this. So this project evaluation, they actually partnered with a university or an academic institution, and it really helped them show that their program was effective, and it helped them apply for later funding. They actually spoke about this at the MIE fundraising conference, which is how we heard of it. And then we also published a short little summary on legalaidresearch.org, which is one of NLADA's, I like to think, very helpful sites in terms of assisting civil legal aid. It has over 450 either peer-reviewed journal articles, ROIs, return on investment, project program evaluations, and you can see how they have done it, who they have served, and what the data has shown. So I know that was a lot of information all at once. And that's more to give you a theoretical view of what can you do once you have this data. So then the fun part becomes, how can you actually do it? Funding is definitely something that comes up quite a bit when thinking about how to collect, analyze, and then distribute this. So something that the National Center for Access to Justice recommends is integrating data collection into your strategic plan. So if you have an emphasis on data collection, you can better make the case to funders, or getting your partners and funders involved. Maybe one of your partnering social service organizations has a really robust data collection process, and maybe they really want to track referrals. That might be something worth exploring with them. You can also use volunteers, such as AmeriCorps Vista members, to conduct follow-up with clients to help collect this data and compile it. So released this January, and I know this isn't, it didn't talk explicitly about civil legal aid. This was more focused on public defenders, but it's still very useful, and it can help you think about how you might partner with local universities. So this guide goes over how public defender offices and academic institutions can have mutually beneficial relationships. So for example, you share your data, they perform the analysis, publish the aggregate data, and then boom, you're done. And you have what will likely be a very positive program evaluation if you are indeed affecting outcomes, which you likely are. I know that sounds a little bit easier said than done, but this guide really breaks it down in terms of this is how you can approach an academic institution. These are the questions to consider leading up to it. This is how you navigate issues about what about identifiable data? Do I want to provide data that can be linked back to an actual individual? And it gives you possible solutions to that. So for example, that question about ethics, researchers can work in your office or work remotely in a different public defender office, so that way you don't hand over control of the data, or you can scrub the data of any identifying information before you actually hand it over. So instead of handing something over with addresses, phone numbers, names, you can just hand over the issues that were involved in the case and the like. My screen has gone white, so let's see. Give me just a second to see how to fix this. All right, just give me one moment. I'm going to try re-uploading this file. Great, so we're back online. We're just going to quickly get to the place where we were. Close your eyes. You're not supposed to see that yet. All right. So another guide and tool that NLADA has for you also comes from the public defender side, and it was released just last month. So this guide talks about project design. For example, talking about a research project which might have two components, such as a practitioner like a civil legal aid or a public defender office coming up with some kind of thing that they want to study. Let's say it's the effects of counsel at first appearance, the quality of representation, whether receiving limited representation or full representation makes a particularly big difference on outcomes. And then the researcher, fortunately, you don't have to do this part of it, but then they'll think, this is how I want to study this. And they can go through the various levels of, do we want to do something that's like a randomized control trial, which the Access to Justice Lab at Harvard University has some handouts and worksheets for individuals who are thinking about maybe doing that, or doing something not quite gold standard, but maybe silver standard, which might look like propensity score matching, or bronze standard. I'm making these levels up as I go along. Bronze standard being like doing a simple regression and saying, as something goes up, something goes down. Or if you have full representation, you're more likely to be successful. Right. As you're thinking about using your outcomes data, we recommend thinking big. So how can you combine your data sources with other sets to show that your work matters? So for example, if at age 35 you help someone who is 35 years old receive benefits, what is the lifetime value of that case? How much money have you helped them receive over the period of their life? And you can use that by combining it with larger data sets. And then as you're going through this, thinking about some of the challenges that you will likely face if you are going to be collecting data around those who have been affected by the opioid crisis. So things like, how can you access transient populations? Thinking about, well, if this person doesn't necessarily have a cell phone that's turned on all of the time, or maybe they move in and out of homelessness or are housing insecure, how can you reach them? That's something to definitely consider as you're doing this work. And we don't have a clear cut, this is how you need to do it in every single example. So we're also hoping that you can reach out to us in the chat box and let us know how you do it, and if you're comfortable with us sharing what organization you work with, so that way we can connect you to as well. And then another thing to think about is, how do you track referrals? What happens when you refer someone to a partnering social service organization, and then how do you keep track of them? How do you know that that referral actually worked, or they went there, and then what's the effect of that? That's something to talk about with your social service partners, and to see if there's some kind of way that you can share data and track those outcomes. And then how do you record data outside your case management system? So this is something that that has come up in terms of like data collections with medical legal partnerships. So how do you do something, or how do you record something that's much more of like a walk-by consultation? So a social worker might come to you and say, is this something that that like you could necessarily help with, or would want to provide more than like very limited advice, or can I ask your opinion on something? Maybe you can store those consults and those conversations in a separate Excel sheet, and maybe you can use a volunteer to do this. So once again, please let us know. Please let us know what you're doing, and we can hopefully connect you with other programs that are doing something similar, or if you have even like a data collection protocol that you would like us to share with the larger community. So with that, I'm going to turn it on over to Elizabeth from Legal Aid of West Virginia.
Hi, I'm Elizabeth Weiner, and I am the Grants and Training Manager at Legal Aid of West Virginia. And by way of just a super short introduction, I am a native West Virginian, and I've returned to my home. It is a beautiful state with a lot of uniquely wonderful features, but it also has a lot of challenges. And paramount during my tenure at Legal Aid of West Virginia has been the opioid epidemic. As most of you are likely aware, West Virginia is at the epicenter of the epidemic. We have, over the last several years, had the highest per capita rate of overdoses and deaths from substance use disorder and opioids. We've also had the highest level of neonatal abstinence syndrome for children born addicted to opioids. And also, by way of very brief background about my program, Legal Aid of West Virginia is an LSC-funded program. We are supported by 20-some grants, and we are in 55 counties across the state and in 12 local offices. So we cover a lot of territory. And in terms of our use of data and screening to address the opioid crisis, I would say that we are very much a work in progress, and that we dived into some things before we had data that we knew to be complete, and then we have been working and collaborating with folks like NLADA and this terrific webinar series to learn more about ways that we can do that better as we move forward. But I think the primary driver for our use of data and screening in addressing the opioid epidemic was our strategic planning process. And this was our most recent strategic plan in 2017. It was actually very much derived from community conversations. The map that you're seeing is West Virginia, and the blue stars are places where we convened. We called them stakeholder and thought leader meetings, but we invited clients, we invited community organization partners, we invited social service providers, we invited all kinds of folks on the front lines, thought leaders in dealing with the issues that our clients deal with every day, as well as members of our client population. And we listened to what they had to say. And the clients and the community leaders statewide were loud and clear that legal needs arising from the opioid crisis was a primary, if not the primary area where we needed to be directing greater attention and increasing our services. And this also dovetailed with information, as West Virginians, as members of these communities that many of us knew. One of the facets of this epidemic is that it has touched so many of the lives of our staff in my program. We have 150 some staff, and we have a number of staff who are raising grandchildren or siblings' children. We have staff who have lost children. We have staff who have lost family members. We have staff who are in recovery. So all the way across the spectrum, it affected us. And so when we were hearing from the community meetings that this was an issue that we needed to be grappling with and prioritizing in our strategic plan, we absolutely felt that was the way we needed to move. So within our strategic plan, we prioritized a focus on the opioid epidemic. And as that has evolved in the implementation of the plan, that has broken out into work on behalf of caretaker relatives, on behalf of crime victims impacted by the epidemic, on behalf of people in recovery, and on behalf of impacted children. And the questions that we were asking ourselves as we got into this were, how are we already serving these clients? As Casey referenced in her remarks, a lot of the work that we do at Legal Aid, we knew we were touching folks who had an impact of the opioid crisis. It was a matter of trying to better track and capture that information and to figure out then how could we serve them better and what funds were out there to build on those services. And in terms of the serving them better, we were very blessed to be involved in some wonderful community partnerships and were able to talk with partners and clients and get a sense of the broad holistic needs that the various groups of clients we knew to be impacted were grappling with. And then in terms of the funds, that was where Karen Lash and the folks at NLADA came in and others who suggested to us that there were various pots of state and federal funds that we should be considering in terms of providing support to our work to serve clients impacted by the epidemic. So the first group that we knew that we were already engaged with were kinship caregivers. And just to give you a sense of the scope, in West Virginia, over 10% of our children, or more than 40,000 kids, are known to live with kinship caregivers, mostly due to the epidemic. And I stress the word known because we are absolutely aware that there are thousands more children who are not known in the system to be, living with someone other than a biological parent who is serving as a primary caretaker. We work in these communities, we work with these clients and know families, and we know that a lot of the families are scared to death of having their situation arise on CPS's radar. And so they try to kind of operate on the down low, but that means that there are legal issues that they're struggling with that are not getting flagged by anybody in any kind of a formal system. So how did we use the data that we had within our case management system and otherwise to make the case that we needed more resources to do kinship work? We already had a project, a long-standing project with our State Department of Health and Human Resources to do safety and self-sufficiency referrals of TANF clients. And that project had been running for over 15 years in 2017. And it was primarily referrals that were coming over of single parent families. And the types of casework we were doing on their behalf were adult SSI cases, domestic violence cases, housing cases. We took a look at our own case management data and checked to see how many of the families we were serving were caretaker relative cases. And we had that information because DHHR, in referring the cases to us, tell us whether it is a child-only case or a two-parent or a one-parent case. And so we had that information in our case management system and we could pull it out. And then we looked at the federal congressional data that they collect from the states every year and saw that the child-only cases made up 71% in 2017 of the West Virginia DHHR's total TANF caseload. And we thought, wow, that is a heck of a disconnect. And clearly there is a large portion of the DHHR caseload that the caseworkers with whom we've partnered successfully for years and proven the value of the partnership didn't even realize that there were things we could do for these kinship families and weren't sending us those cases. So we went in 2018 and made a pitch to our DHHR for enhanced kinship services and ended up not only getting refunded for our existing staff, which was about 18 people at the time, but also got funding to bring on additional staff to really beef up our services to kinship families and to create a statewide kinship resource attorney who creates a lot of educational materials, does a lot of community speaking, and backs up our staff in our local offices. Just this page on the types of cases is just to stress that in working with any funder, I think the data is absolutely critical, but the other thing that it needs to be coupled with is pretty aggressive funder education about the types of work that you can do for the client population. This slide shows that we were really emphasizing when we went to DHHR to make our pitch that these families have complex, interconnected legal needs. And the primary need is generally around a question of permanency, but from that flows a whole raft of questions and decision points around entitlements, benefits that flow from the different choices. They can have knock-on effects in the benefits that the child is eligible for if a grandparent is getting some kind of VA benefit or Social Security, and different things that they might be or might not any longer be eligible through DHHR. There are tax consequences, and the heartbreaking reality is that when you have literally great-grandparents, and we've had many of those cases raising kids, they have concerns about what's going to happen to those kids when they're gone and how they're going to be provided for financially and in terms of care. Little bit of information. I'm not going to really go through this, but if you are needing extra external data to beef up a project application, there are lots of great resources and sources you can look at to pull out your certainly your state data, sometimes down to the county level. When we did our Lawyer in the School project, we looked at school district data, but information that you can use to feed into an application for funds from all kinds of outside sources. Okay, another area where we were already providing services, and I'm not going to do such a deep dive into this one, but just reference it, that because we did use data around the opioid epidemic to sustain and grow our work in this area, is to utilize opioid epidemic data in asking for enhanced funding, and in one major instance, new funding for services to crime victims. And the areas where we did that, we, during the time of our most recent strategic plan, we have secured additional VOCA funds, as well as our first ever LAV grant. We for years were a sub-grantee with our State Domestic Violence Coalition, and then the coalition lost their grant, but we just got word that we have been funded to do a new LAV grant. And in those applications, we absolutely talked about the impact of the opioid epidemic and some of the data that we had with regards to that. Mostly those were focused on kind of additional information. A lot of the focus of those applications was on the victim population, and the data, the external data, was related to crime statistics and domestic violence and sexual assault statistics. But within some of the information about the opioid epidemic, there is increasingly information about human trafficking and data that indicates that as a corollary to the epidemic, there has been an increase in human trafficking crimes in areas that have been heavily impacted by the opioid epidemic. So we definitely highlighted that and just got funding for a specialist human trafficking attorney who's going to be also, you know, serving a number of domestic violence clients, but will be doing human trafficking cases around the state and serving as a resource and educating the community on what to look for and recognizing those cases. We also secured a crime victims grant through a new funding source that Karen Lash and NLADA identified for us, and that was to serve opioid impacted children via a Lawyer in the School project. And it was the Youngest Crime Victims Grant. It was a VOCA grant, and we made the application proposing that we replicate a very successful model that we had done as part of a different pro bono project, but through which we learned how many of the kids in the challenged elementary school in which we were working were being raised by non-biological caregivers, non-biological parent caregivers. And so we made the pitch to expand that grant, or to expand that work through the VOCA grant, and were awarded one. So again, we used the data that we had about the Lawyer in the School project and information about the number of non-parent caregivers in the original project. We used statistics that were available through various sources about the prevalence of opioid impacted families in the communities we were looking at, and in the particular schools we looked at just data that was available through the Department of Education. The next group that we had targeted, that we have a relatively new resource and are just starting to ramp up, is addressing the legal needs of people in recovery. And for this one, we have an Equal Justice Fellow who's just came on board with us. I would say that, just as a sidebar, that one terrific way to pilot something that you are interested in getting started, whether it's serving a particular population or launching some kind of new service area. We have found at Legal Aid of West Virginia that fellows have been a wonderful resource. We had 2 fellows from our local law school who worked with the early stages of our kinship work and did a lot of community outreach and developed a lot of wonderful materials. And we just this October had come on board a wonderful equal justice fellow who is launching a medical legal partnership with a local clinic that is doing medication-assisted treatment and holistic, as part of a suite of holistic recovery services that include counseling and medication monitoring and psychiatric help. And we are going to plug in and offer a legal component. And so we're extremely excited about that. To secure that, we really focused on, again, since it was brand new, we used external data that we had about the population and about the recovery population in the area where the project is going to launch. And we, excuse me, we stressed to Equal Justice Works, again, this holistic range of issues that we were hearing from the potential community partner that people had needs around. And so I think educating the funder again around the full scope of what you can do for folks and the fact that, you know, you may be serving an individual client who may have 3 or 4 different legal matters that really are in need of being addressed in order to allow that client to move forward successfully. The area where we are, I think, really in the stages of just ramping up and pursuing, the projects I've talked about thus far are projects where we've already secured funding, or we have built on funding that we already had in existing projects by highlighting the opioid work. The area I'm going to talk about now just briefly is an area where we are in the process of pursuing funds, and that's the legal needs of impacted children. We do currently have a project that is a children's mental health focused initiative that is funded by a block grant that we receive. It's passed through the state, but it is the Kids Mental Health Block Grant that enables us to do work for children with mental health and behavioral health challenges in the school system and to do advocacy for them around IEPs and education plans. We're currently working to expand funds for legal services to children using some of the opioid-related data that we have internally and some of the external information that we've collected. And we're aware that the issue is not just a kid who has grown up with trauma because of a parent's substance use disorder being part of their life, but also that increasingly the data from external sources show that children born addicted themselves who have neonatal abstinence syndrome are going to have potentially serious challenges when they hit the school system. So this is just a little bit of the information that we're kind of highlighting as we start to talk about that kind of work with potential funders, and we're going to be looking at our own data and trying to get a better sense of how many kids we are currently serving who have these issues, and then put that together into a pitch as to how we could help more if we could expand our resources. Again, these are just the needs in addition to education or things I've referenced already about SSI for kids' SSI cases, and honestly, whether the funnel is, or the funder's hook is through wanting to fund children's legal work or a specific kinship caregivers project. You know, if you're working on a funding pitch for children's legal work, we certainly hope that we can expand that out to include the ability to do some custody work on behalf of some of these kids too. Okay, so how has our case management system kind of enabled us to start to do a better job at collecting this data and utilizing it in our reporting to our current funders and in our ability to run various data sets and show the ways that we're already serving these clients and pitch to potentially new funders that we have an increasing number of clients with these issues and that we would be a good fit for various pots of money. Initially in 2017, we created on our case management system, and we have Kemp's Prime, a intake box, and we did some training for our intake staff. And so you'll see that the area on the screen where, if you're getting my cursor, if not, it's down in the bottom right hand, about 3 lines up, there's a drug usage box. And we had our intake staff noting at intake if the client referenced any facet of their case that indicated that the family had been impacted by drugs or by substance use disorder. And so that was how we started initially to attempt to collect this information. And we also asked our advocacy staff, our lawyers and our paralegals at the time that they were closing out the case, if they had learned subsequently, or if in the interim drug usage, substance use disorder had become an issue in the case, we asked them to go back and check this box. Well, as you can imagine, since this box is on what's an intake page, it was not necessarily something that case handlers and support staff were remembering to do at case closure. And it wasn't terribly sophisticated in terms of, you know, being able to report on a more nuanced information about how the substance use disorder was affecting the family. So we have evolved, and so the next slide I'm going to show is our current closure page that we have developed, and you'll see there's now a page that at case closure we ask the advocacy staff as well as the reviewing support staff, and our supervising attorneys also do periodic reviews to check one of the categories, and there's a category where substance use is not applicable in the case at all. And then we wanted to know, one of our funders was interested in, and we thought it was good information to collect and to have in the aggregate, is the issue that our client has had substance use disorder? Is that, are we serving someone in recovery? Is it that the adverse party has or had substance use disorder? Or if in the case of our kinship family cases, that the family has been impacted by substance use disorder in some way? And so those are the choices, and logically you have to check one. So we are at the beginning stages of using that tool. We're working to have a pop-up box or some kind of error message if people do not actually check one of them. And we're also running reports monthly to see whether there is a box checked. And then also you can see in terms of some of the other information that we collect, when you cross-match that with the drug usage checkboxes, can really generate some powerful tools to be able to tell the story of our services. We also collect information around kind of these major areas of priority for our services and these groups that we want to be telling funders that we're serving, whether we're assuring income stability, whether we're assuring safety, whether we're assuring housing security. And so we can also now run reports that, you know, can kind of cross-match if one of the substance boxes is checked, which of these positive outcomes or goals are being met in a case, and how does that map out against case results. We also have a separate outcomes page, which I probably should have provided as well, where we collect avoidances and awards and kind of gauge if there's been a monetary impact in the case, as well as other case benefits that may be, you know, that are more subtle than whether or not there was the client's goals were achieved or not. So that is what we are doing, and we are very excited about the ability that's going to give us to collect more information and better report on the services we're providing to impacted clients, which we think in turn will allow us to keep our current funders better informed and to support future funding requests. And that's all from me. My contact information is here, and I'm going to pass things back to the folks at NLADA.
Great. Thank you so much, Elizabeth, for going through how Legal Aid of West Virginia is screening and tracking clients and opioid and drug use. So we've gotten several questions in already, so I'm going to just launch right into them. And then if you have any more questions, feel free to send them on over in that chat box below. So the first question is to you, Elizabeth. How do you ask the question to clients, how are you affected or are you affected by opioid?
I think at intake, they are asking whether their case has been impacted by substance use disorder. And if the client references something as part of the facts of the case, even if they don't necessarily connect the dots, then the intake staff will note that. But you know, if they ask the family or the client if there is an issue and that they've been dealing with as part of their case and they don't identify it, then the intake staff will not check the box, and then it would hopefully be caught by the case handling staff if it arises as an issue in the case, and it would be tagged at closure.
Great, thank you. And then another question for you. Do you ask the drug usage questions of all closed cases, including advice, or just extended service cases?
All closed cases.
How do you gather data regarding children victims of the opioid crisis when the caretaker has no legal status, but the children are U.S. citizens, but caretakers are afraid to ask for help due to have been targeted for removal? Multiple parts to that question.
Yeah, and I would say that I am not the best person to address that. West Virginia does have a small immigrant population, but it is not enormous, and I know that we have had a few of these types of cases, but quite honestly, I don't know how the case handlers have proceeded with that or how the intake staff attempted to navigate that.
And then if you have more questions related to that, to the person who asked that, if you reach out onto resource desk at NLADA, which is the email address that we use for individualized technical assistance, we can connect you with like another legal aid organization that works with, like is in a community that has a larger proportion and population of immigrants. So putting in a plug for resource desk. And
yeah, I just wouldn't want to misspeak.
Yeah. And then we have two questions that look like they're directed at me. So how do you calculate the lifetime benefit you help someone receive? Does that mean you're assuming their life expectancy, and where do you start with that? So yes, you are assuming their life expectancy, which you can find through the Bureau of Labor Statistics. This example was actually referenced in the National Center for Access to Justice's guide as a way of using quote unquote big data to help make your case. So you can use data around race, gender, age, the amount of compensation like from the back that you've helped them obtain, and then you can go from there. It's on page 20, the example, so if you want to go look at how they did it, and then it also includes a link to the report. So please go ahead and check that out. And then another question is, one thing we struggle with is putting a dollar value outcome on gaining access to Medicaid. Right now, we don't put any monetary value because we don't know how to properly determine it, but obviously it is quite valuable. So to answer that, I have two examples of return on investments that I know of that have used Medicaid and Medicare as a way of showing, look, you fund civil legal aid, we give you X dollar amount in return. So the first one is a 2016 Florida Bar Foundation report, and that one looks at the dollar value of reimbursements received by Florida healthcare providers. So it finds that there were almost 900 cases that were related to this, and they had an effect of over $70 million. And then the second one goes a little bit more in depth on exactly how they calculate that. And that one is called Social Return on Investment from Legal Services, a Statewide Analysis Report to Another State ROI. And that's from Delaware, and that's referenced throughout. So you can find those both through a quick Google, or you can find them on legalaidresearch.org. And then let's see if we have any other questions. All right. Just for clarity, intake staff at Legal Aid of West Virginia ask about substance use possibly affecting the household in all client intakes.
They ask if the family's case that is that they're seeking the legal services with, if there's been any impact of substance use disorder.
And then how do you define substance abuse? Do you include alcohol abuse?
I mean, I think that in terms of the projects that we have done, the focus has been on the opioid epidemic, and a lot of the data, the external information, the statistics that we've deployed to seek those funds have been focused on the opioid epidemic. But I think that all of the project work that we've done has been has addressed substance issues generally, and I'm trying to think if there was a funder that, I don't even think the VOCA project limited it to opioid use. I think that it was in response to the opioid crisis, but was providing support to kids impacted by substance abuse in general. I think our program would definitely take the view that if a client reported substance use and they were talking about alcoholism, that it would be included. But that's a good question. I mean, maybe that's something that we should take a closer look at.
And then we have one more question, and that is, will these slides be recorded, available, and will the PowerPoint be available? The answer is yes to all of them. The PowerPoint is currently available on the NLADA website, and then likely on Monday, we will also post the recording to our public YouTube channel and link that to the same web page. So since there's no more questions, feel free, as I just go very quickly over the last slide, if you have any last-minute burning questions. But before you go, if you liked this webinar series and you like us in general, help us better meet your needs. We have a survey that we will also be publicizing at our upcoming annual conference. And it asks you about strategizing for non-LSC federal funds, which Elizabeth very much touched on, and how NLADA and Karen Lash / the Justice and Government Project has helped you. And then NLADA and the Justice and Government Project also have a curated research newsletter where every month we send you, I like to think it's a very well-developed research newsletter in which we send you summaries of the latest research, information on any sort of legislative updates around a particular topic. So we released the October one, which was focused on opioids in early October. You can access that issue on Legal Aid Resources by going to Helpful Tools. And then you can sign up and get upcoming ones in your inbox. November will be on foster care and children. And then, as always, you can reach us at resourcedesk@nlada.org if you are seeking some more individualized training and technical assistance. Thank you so much, Elizabeth, for speaking on this webinar. We greatly appreciate your expertise and answering all of the questions. We look forward to seeing you at annual conference.
All right, I'm looking forward to it as well, and to seeing so many of the folks that are on the phone.
Great. Well, have a great rest of your Friday, everyone. And I will be sending a follow-up email with links to the slides. I'll also include links to the Florida Bar Foundation report as well as the Delaware one, in case anyone else is curious about how legal aid organizations have calculated the benefit received from Medicaid. All right, thank you.